The most transmissible infectious disease is now in our state. The first case of measles has been confirmed in Pueblo.
Tonight, health officials are urging everyone to take this disease seriously and get vaccinated. Your reporter Sarah Horbakowitz spoke with a mom earlier today and shares her perspective.
Yes, I'm worried about my son because kids go to school and they interact with a lot of other kids, and we don't know what kind of viruses or health issues the other kids can have.
So on Tuesday, Gracel Gonzalez brought her 6-year-old son to get vaccinated at Denver Health's pop-up clinic at Joe Shoemaker School.
What made me come today is the accessibility, because it was very easy so he can get the vaccines that he needed. Since he was born, he's gotten all of his vaccines.
That accessibility coming as Denver Health sees more questions about the measles.
We are definitely seeing an increase in call volume. Routine childhood vaccines for MMR is 12 to 18 months and then 4 to 6 years of age.
Recent state data also shows that some schools like Joe Shoemaker were at risk for an outbreak last year.
We're doing this really to help protect the kids and keep them in school. Last year we saw a big effect of the varicella outbreak, and then obviously we had COVID, so we don't want any of the kids to be harmed or affected by measles.
Johnson says there still may be vaccine side effects like aches and a low-grade fever, but says it can be better than risking possible lifelong complications from the virus.
After one dose of the vaccine, it's 93% efficacy. So 93 out of 100 people will most likely not get measles if they're exposed. And then 2 doses is 97%.
And there is still a way to check your vaccination status if you don't know.
If you're unsure if you were vaccinated, then you can go ahead and get the lab test to see if you have immunity to measles. And if you aren't immunized or you don't have protection, then you can get the vaccine.
Johnson recommends talking to your doctor about any concerns, and the clinic is set to continue Wednesday.
Eres muy fuerte.
He is very strong. Show me your muscles.
Wow.
And when it comes to vaccinations for adults, Johnson says anyone born before 1956 has presumed immunity due to exposure. For those vaccinated between then and 1968, you may be eligible for another vaccine depending on what you were given at the time. But Denver Health says anyone vaccinated after 1969 should still be protected. If you don't know, though, you can still check with a blood test.
You know, Sarah, this is a concern for a lot of parents, especially those of us with young children. My wife and I have a 10-month-old at home. So what are doctors saying about kids who might not be old enough to get the full vaccine yet?
Yeah, Denver Health said they're getting that question a lot from a lot of concerned parents. And they say that some children, 6 to 11 months, can get a shot for international travel, but it still doesn't count towards that routine childhood vaccine.
All right. Thank you so much, Sarah. We appreciate it.